The first time we did this, we did it as a feeding fun night, which is basically a bunch of therapists coming over to my house, and we have food and often alcohol, and we talk about feeding things. And so I wanted to know what's going on with thickeners. And so I did a bunch of research, and we got, if you are sick in bed and on pain medication and have access to Amazon and that one-click button, I ordered so much stuff. It was so much fun. Oh, do you guys know how patient that man is? All right, let's see. Maybe we'll put these things here. So, anybody kind of confused about what's going on there with thickening? Anybody wondering what I'm supposed to use, with who, for what, for how long, how much? So, I decided I was tired of being confused, and what I do when something bugs me is I attack it. And so I'm laying there in bed, and I was having times when the fog would clear enough that I could think. It's kind of like a picture of the San Francisco Bay Bridge, in the fog, and every now and then you can see the top, and then it sink back down. So when I was up high enough, I would work on stuff. And when the fog rolled back in, I'd go back onto Pinterest. And then I'd come back up. Pinterest is the lowest level of cognitive function before coma. Okay, right before the Glasgow coma scale. I never thought about that, thank you. I seriously, I have this whole continuum, Pinterest to Facebook to email to... So I decided I want to figure out just what the heck is going on here. And as I told you earlier, there's the disclosure statements that we are filming this for CEU Espresso, and I do have ownership interest, and I am an employee. I might get a speaker fee, and I'm sleeping with the other owner. And then, I'm actually blushing now. Feeding and Dysphagia Resources is the name of my private practice. I own it, I employ myself, and I sometimes get paid. And we're going to talk about the rescue wedge. And as I told you earlier, I'm a friend and colleague of the developer. Okay, let's talk about thickening. Like, how long have we been doing this? When I first went to put this together and to teach it, and I knew that for Feeding Fun Night, we get CEUs for Feeding Fun Night. We apply ahead of time and have CEUs. So I'm a last-minute kind of person. And I wrote the description because it had to be in to TISHA and TOTA and everything like that to get the CEUs, but I hadn't written it yet. And I got down to the point where I was writing, and I had said, we're going to look into the history of thickening. So I went to look up the history of thickening. The only thing that came up was an advertisement for my presentation. And I went, oh, this is not good. This is not good. Okay. So, first of all, what is thickening and dysphagia? Why do we do it? Our whole thought is that we are trying to give better oral control, that it gives more time to initiate and organize the oral phases, because thin liquid just washes and splashes and you can lose control really easily, and bam, it's over and down. So it helps with organization. Also helps with suck, swallow, breathe coordination in our young ones that are nippling. And it can also give more time for bolus formation in the thicker consistencies. It also, we think, gives slowed pharyngeal transit, hopefully reducing the frequency of aspiration. You notice I didn't say eliminates aspiration. That's very important. So I went looking for the history. I did find, finally, that Suzanne Evans Morris, in a post on the dysphagia listserv, mentioned that back in the 60s we were using naturally thicker foods. We try to go to thicker foods. Well, that makes sense. In the 1980s, we started seeing starch-based commercial thickeners, like Thicket. Okay. And then its spin-offs. In the 2000s, I'm not sure what we call that decade, but in the 2000s, we started seeing gum-based thickeners coming out. For example, Simply Thick, right here. Everybody's kind of familiar with these little packets. We've also used it in the past for reflux, trying to reduce reflux. The idea is that it's heavier, so it won't come up as much, and we'll reduce the frequency of the reflux maybe, and maybe how high it comes up. We don't know for certain. This is a theory we've got. So even back as early as the 60s, doctors were saying to add rice cereal to the formula. Anywhere from a tablespoon per ounce to a tablespoon per 4 ounces. Now, a tablespoon per ounce, just to put that in perspective, that's 3 teaspoons per ounce. That's kind of sludge. That's pretty thick. We started using starch-based thickeners in the 90s and gum-based in the 2000s. Again, the whole idea thinking if it's thicker, we might reduce the reflux. Now, you'll notice if you go reading the ingredients, because that's where I started. What's in this stuff? Why? And I kept seeing modified food starch. What's that? Went looking. It's basically a starch, a food starch. It can be corn, it can be rice, it can be tapioca, but it's been altered so that it performs better at different temperatures, specifically heating. A lot of times when you heat the starch, it doesn't thicken the same way. But most of our food is heated to serve, right? So some examples of starch-based thickeners. Rice cereal. And in babies, that tends to be where we start looking first, and that's a rice starch. There are other baby cereals, oatmeal, barley. These are grain-based starches. And I've used those as alternatives to rice cereal before. Thicket is cornstarch. And just so you know, Thicket 2 is not, it's not like double strength Thicket, which is what I thought. It's cornstarch with less sugar, so it's more diabetic friendly. Thicken Up Clear. I've got some of that here. So here's the Thicken Up Clear. You can get it in a can with lots of powder. You can get it in little individual packets. You can get all this stuff off Amazon. Ordered it all. It's a hybrid. It's cornstarch and xanthan gum to kind of give it qualities of both. You can get stuff like clear gel. I got that. That thickens. It's not very, help me with words, steady, consistent. It's more for cooking and baking. Potato starch. You can just get bags of potato starch. You can use potato flakes. Tapioca comes from the cassava plant. It's better for freezing. So if you have something you're thickening that's going to be frozen, and we've got one of the thickeners we'll see on a slide also has tapioca starch in it. Arrowroot powder. You can get this in the spice section. It tends to be better for gravies. But can you use it? Yes. What's maltodextrin? That's often listed in the ingredient list. What is it? Yeah, it's sugar. Yeah, it's a very easily digestible carb derived from starch, usually corn or rice. When you see it on the ingredient list in the thickener, it's usually a corn base, might be a rice, but it acts like a simple sugar because it's broken down into glucose so quickly. You may as well just put sugar. So if you're starting to read labels of foods that you're eating, you see maltodextrin, just go sugar. What are the pros and cons of starch-based thickeners? Well, they're easily available. You get them in the grocery store. You get them on Amazon. They're fairly cheap. Rice cereal is easy to get. However, because it's starch, broken down into sugars, there's more calories. In fact, for an example, there are 14 calories per tablespoon in rice cereal. Now let's think about a little baby. Let's say we're thickening with 2 teaspoons per ounce. And they get, in a day, let's say 40 ounces. So 40 times 2 is 80 teaspoons. So divide 80 by 3. Somebody do that for me. 25-ish. Okay? So then 14 times 25 is how many extra calories you're adding. You can bump that kid up. Huh? 350 calories. That's a lot to add to an adult. Okay? It's broken down by amylase, an enzyme in breast milk. So if you're thickening breast milk, it's not going to stay thick very long. I did it. That's what I was doing with Jonathan for the longest time early on. Because that's what we were told to do. We thickened with rice cereal. He had severe reflux. I pumped, thickened with rice cereal. Wasn't doing anything except keeping us both up longer. There's a whole thing going on about arsenic in rice, and we're going to cover that. And how serious is it or is it not? In rice cereal, for instance, we have additives. We have iron. Well, if you're doing that much, couldn't you not get too much iron? It's also constipating. And the starch-based thickeners tend to be lumpy. They don't dissolve very thoroughly. Think of your gravy when you thicken it with rice with cornstarch. Let's talk about the rice and the arsenic. What is going on here? I'm going to explain it because I want to point out it wasn't the FDA who brought it up. It was Consumer Reports who brought it up. That's important. Okay. You have to understand a couple of numbers first. There's a federal limit for what they consider a safe amount of arsenic in drinking water. They don't have anything about a safe amount in your food. The only guidelines we have is for drinking water. And the EPA proposed 5 parts per billion. And that's what it was going to be. But then the federal government said, no, that's a little too low. Let's make it 10. It was arbitrary. So they said, make it 10. But New Jersey said, nope, we're keeping ours at 5. There's politicking going on. There are no long-term studies in the U.S. yet about the effect of chronic exposure to arsenic. There are some international studies. And the International Agency for Research on Cancer links chronic arsenic exposure to a higher risk of lung, bladder, and skin cancer. Do you hear me using the words chronic and risk? The best study was an unfortunate accident. There was a little town in Chile that they came in, I don't remember the year, it's like in the 50s, and they put in a water treatment plant. And then, so everybody in the town was drinking this water from when the treatment plant opened until, I think it was like 1972. When they discovered that the treatment plant, there was something going wrong, and everybody was getting high exposure to arsenic all this time. And they stopped and changed and fixed the treatment plant. So we have a begin date for exposure and an end date. For a scientific experiment, that's wonderful. If you happen to be a member of the town, that's not so good. So they've been studying these townspeople and looking at them long term and saying, well, what do we see? And they're finding higher incidences of lung and bladder cancer, higher incidences of kidney cancer, higher mortality rate in young adults. And what that is they're dying of lots of different things, but they're just dying a lot more at this age than is common in the rest of the population.
I have a question.
Mm-hmm.
It says the federal limits is 10 parts per billion.
Mm-hmm.
Well, if people in Chile, what was their exposure?
That is an excellent question, and I do not have it at the tip of my tongue. But if you hang around, I think I've got the study, because I try, especially for this one, I try to bring everything. We can look and see. But that's an excellent question.
Because, if it's a whole
Are we talking apples or oranges? Mm-hmm. One thing they noticed is that the risk for higher incidences of this continues for up to 40 years after the exposure has stopped. They're still seeing higher incidences of cancer and mortality. Okay, why? Are we doing this? Is this a genetic thing now? Is this it's in the ground? What's going on? We don't know. We're looking, we're studying. We do have a small study that was linked rice consumption to higher arsenic levels in humans. Rice consumption. Now how much? A half a cup per day. It's not a lot.
Yes, I have a question because it's interesting that you're talking about this. I have a 6-month-old and he has reflux and I'm very thin twice a week cereal. I'm eating his bottle at night and to this day, as of now, he's still not able to sleep at night and there's a lot of different things that he does throughout the day and at night. So are you saying this is just particularly in rice?
There is less arsenic in oatmeal than there is in rice. But hang on before you make any drastic decisions. Okay. Let me ask you, is it working? Is adding the rice cereal working?
It has prolonged just to maybe an additional hour, but it hasn't been consistent. So I would say overall, probably not. I think that because he's getting older, that's probably why he's able to see more. I don't think it's moved to the rice.
After I'm done with this, you'll have more information to make some informed decisions. Oh, that was a good boundaries thing, wasn't it? I'm learning too. Here's something that nobody's talking about, though. Do you know that as far as sources of dietary arsenic, we all get arsenic exposure from the foods we eat. You've got to realize that. The most exposure we get is from vegetables. 24% of exposure to arsenic is from vegetables, but we're not running around saying we're not going to eat vegetables. Don't give this ammo to your kids. From fruit or fruit juices, 18%. Rice comes behind produce as far as your exposure.
Is the arsenic coming from, like, environmental, rainwater, like pesticides? Do you have any studies on what the sources of that is?
It is just in the ground, in good ground, in organic ground. It's natural. We have yes, exactly. It's on the periodic table. Pardon? Polio? The polio virus? Really?
And that's why people think that children didn't get it.
Because they have been exposed to enough buildup of immunity already. There is 5 times more inorganic arsenic in rice cereal than in other cereals because of the rice. 76% of the U.S. domestic rice crop comes from Arkansas, Louisiana, Missouri, and Texas, which we coincidentally have the highest levels of arsenic in our ground. And it's higher in brown rice than in white. So you've been eating brown rice thinking you're more healthy.
You are?
We're going to talk about that.
So Chinese people who eat rice all the time, do they have a higher incidence of, or is it the way that they?
We don't know. Her question was, Chinese people who eat a whole lot more rice than we do they have higher arsenic in their blood levels and whatever? Do they have higher cancers? People haven't looked at it yet. Don't know. These are phenomenally good questions. The reason it's higher in brown rice than in white is because it's in the husk. And so you're going to have more in brown. Now, among the rice cereals, right now, and this will be changing, Nature's One dairy formula has 0. Beech nut, oh, and I couldn't get that on Amazon though. Beech nut has 0.8 to 1 micrograms per serving. For reference, Gerber has 1.6 right now.
Is that the nature's one, the one that's organic on it?
Yes,
So that's why, because it's organic.
not necessarily. Some of the other stuff is organic and still has a lot of arsenic. Organic will not make a difference. But I will tell you, Gerber's working on reducing it. So I'm sure they're very motivated to do that. Now, what started all the hullabaloo was Consumer Reports came out with this article looking at it. And they went through these parts, the 10 parts per billion, 5 parts per billion, and said, well, we don't have any guidelines for food, but if we do it based on the drinking water and try to apply some of that to food, what would we come up with? And so they came out saying that basically they recommended no more than 1 serving of infant rice cereal per day. What's a serving? A quarter cup. Which then I had to go, okay, well, what is that in spoons? It's 4 tablespoons or 12 teaspoons. So you look at that and do that math as well. And you can still find this article online. But notice, rice milk, approximate serving, 1 cup. You should have no more than half of that per day. And that's if you're not having anything else here. So this is your total allotment according to the recommendations of Consumer Report. Now, let me say this. I was talking with Dr. Silverman at the time at the FDA because he was the one leading the investigation about Simply Thick. And I said, well, my gosh, what do we do if we can't use Simply Thick and rice has the arsenic and so forth? And he's a fantastic guy. He talked to me for like 45 minutes on the train. You can pick up the phone and call him. And he said, you look at the risk-benefit ratio. Do you want them to have aspiration pneumonia now? Or do you look at, we've got a little higher risk of these cancers maybe down the road, and tell them once he's not having reflux or aspiration, don't eat a lot of Chinese food. Everything is a cost-benefit ratio. You are never going to live completely risk-free. And we look at all of the people who right now are doing gluten-free diets and doing rice flour instead. That's a lot higher exposure to arsenic. So you don't get on your high horse about any kind of food thing going on. Now, the gum-based thickeners that have come out, the first one was Simply Thick. That is xanthan gum, and it's a gel. It comes in a gel. Hydra-Aid was a knockoff on Simply Thick. It's no longer on the market because there were some patent infringement problems. I don't remember. Help me. I'm lying. Oh, Simply Thick was the first gel-based thickener to come out. That was what I was saying. And I just want to make sure I'm not going to miss some of our holiday moments. Okay. So Simply Thick was the first one to come out. Hydra-Aid came out a little bit later, and it was kind of a knockoff, but there were some patent infringement problems, and so they're no longer available. Gel Mix is now out. And first of all, there's the Simply Thick. Gel Mix is now out, and it's in a powdered form. It's not xanthan gum, it's carob bean gum. And just so you know, carob bean and locust bean gum are the same thing. You can get that. Thicken Up Clear, which was this. That one's the hybrid. So it's cornstarch and xanthan gum, and it is powdered. Thick It Up. They're like, we're going to cover all the bases. We've got locust bean, guar gum, and xanthan gum, but it's powdered. And then Thick and Clear, it's not really any of it. It's cellulose-based. Wood pulp and cotton with some sugar. Okay. And I thought I had a can, and I went looking for it this week, and I can't find it. Now, what are the pros and cons of gum-based? Well, guess what? Because it's not broken down by amylase, it will thicken breast milk. So that's why we were using it in the NICU. It is more stable over time. This is a Simply Thick nectar and Simply Thick honey that I mixed this morning about 7 o'clock before y'all got here. They're still thick. They're still the same thickness they were this morning. Now, this is something I thickened with rice cereal at the same time. Do you see how it's separating out? This is rice with water and rice cereal. I did everything with water. I did apple juice. Did water thickened with apple sauce, because a lot of times we'll do that. You need to come by later and see there's a lot more apple pulp down here than there is up there. This is the thicket, and actually it's not too bad. It's staying pretty good. And that's 7 hours. And the gel mix is, you guys, it's kind of thin on top. I've got some settling down here. So maybe I didn't stir it briskly enough. But I'm a professional and I thought I did. Okay? What would happen with parents? Or with the kitchen staff? And what? Oh, I heated it too. We'll talk about that. They do say on there that once you mix it, remix right before you serve. So, and we will talk about that. Her question was, and how good is the breast milk or formula after you've heated it up? You just wait. I was geeking out yesterday. No, I mean, you're going to go, oh, Jen, you need more drugs. All right. So, more stable over time, less lumpy, no change in taste, but might cause neck. We'll talk about what neck is. Also, there are higher levels of potassium which can interfere with kidney function. For instance, in 4 ounces of the nectar amount for Simply Thick, you'll have 20 milligrams of potassium, but less than 1 in thickets. So your dietitian needs to be involved in the calculations and in the decision of what thickener to use. How many of you have actually asked the dietitian? Gel mix doesn't have any potassium. Whereas starch-based thickeners can cause constipation and slow down the GI system, gum-based can speed things up, and you can actually get diarrhea. There may also be an allergy to galactomannins, which are, it's what the gum stuff is. So you can develop an allergy to it. You've got to follow the instructions carefully. Because, for instance, with Simply Thick, they say whisk it. And so I actually have a whisk, but if you don't, you use a fork. You don't use a spoon with Simply Thick. That won't break up the gel enough. You've got to really whisk. With gel mix, you shake it. You put it in, put a lid on, and shake it well. With thicket, you stir. Each of them said stir briskly. Thicket and thicken up clear. Stir briskly. Now let's talk about the Simply Thick neck connection. Simply Thick was originally marketed for adult dysphagia patients. And by the way, using it for reflux is an off-label use. It's important to remember. Now, I do want to say this. Simply Thick didn't go looking to get into the NICU. They didn't go saying, hey, use us for babies. You know how that happens? We therapists who worked in the regular part of the hospital and in the NICU said, hey, I've got this stuff that I use out here. I want to try it in the NICU. We're the ones who went and said, can we try this? The same as what happened with the Z-Flow pillow. Keep that in mind. First of all, what is neck? It's necrotizing enterocolitis. It's basically tissue death in the intestines. And this is why we didn't do this right before lunch. Some symptoms would be abdominal distension, bloody stools, lethargy, and irritability, because I don't feel good. It's basically the intestines are dying. Here's what happens. Neck usually starts or happens due to an infection or at the very beginning of feeding, of switching from IV to stuff going through the GI tract. It's usually a pretty quick, if it's going to happen, it's going to happen right away. In May of 2011, the FDA posted a warning that they had become aware of 15 cases of neck following the introduction of SimplyThick, meaning the kiddo had been put on formula or breast milk for a while, then started thickening with SimplyThick, and then we got neck. That's usually not what happens. And there were 2 deaths in those 15 cases. So they did a case study. They started looking, okay, let's look at all the cases and let's evaluate. And of 22 infants with neck following the ingestion of SimplyThick, they showed 19 developed it after 37 weeks gestation weight. Okay, honestly, guys, that's pretty significant. When I first heard about the neck SimplyThick thing, I was going, oh, come on. I'm sorry, but babies in the NICU get neck. How in the world can you be linking this? Then I went back and read, and I went, developing neck at 37, that's a term. They've been eating for a while. That shouldn't happen. 50% of them developed it after going home. All right, that's not normal. So I understand the concern. 7 of them had died. Why? There are theories. There's no for sure. The theory that Dr. Silverman has put forward is that it's an accumulation of short-chain fatty acids produced when the intestines are breaking down the xanthan gum. That the intestines aren't able to break it down well enough. We've got too much going through the gut, and we just can't handle it. They literally just can't handle it. Someone else was saying, well, maybe we're just overstimulating that premature gut. It's an immaturity issue. So the FDA came out with these warnings. In April of 2013, they cautioned against using it for any baby under 1 year, regardless of whether they were born prematurely or not. They said, let's just be safe. Let's err on the side of safety. SimplyThick themselves say don't use it for anybody under 12 if they have a history of neck. Per Dr. Silverman, the FDA is not going to change the recommendations and the warnings because there have been no new cases of neck in older babies since the warning came out. We are not going to be able to establish a for sure causative link. How would you do that study? Hi, we need 50 babies to be the control, and we need 50 babies to give neck or to give SimplyThick to. It's not going to happen, right? Now, let me say this again. We're the ones that brought it into the NICU, saying we think we have an answer. Nobody knew that it might affect the gut like that. So I get upset when I hear people vilifying SimplyThick. They weren't out to just do anything at whatever cost to make money. They were trying to help. We were the ones saying, let's try this. The doc said, ooh, this might be good. There's so much we don't know. And xanthan gum has already been cleared by the FDA as a food additive. You'll notice on everything I have up here, there's no FDA study saying it's safe for thickening or aspiration. Because every one of them uses a substance that's already been GRAS, generally recognized as safe, to use as a food additive. None of them up here are medical. They're all classified as food additives. So, gel mix has come out. It's carob bean gum or locust bean gum with tapioca, maltodextrin, with some calcium lactate. Calcium lactate thickens a little bit too. It's kind of a stabilizer, and then they can say, oh, when you get more calcium. It's been used, carob bean gum has been used in Europe for pediatric thickening since the 50s in baby food. Not to the degree that we're adding it for thickening for aspiration. Keep that in mind. The liquid must be warmed to 100 to 120 degrees before the thickener is added. And I'm going to show you what that means in a minute. And you shake it as you mix it. It gets thicker as the mixture cools. It goes from a nectar to a thin honey over 20 minutes. And let's look at this. I went, what's 120 degrees feel like? I want to know. So this is actually a picture I took yesterday. I homeschool and we're doing chemistry right now. So I have beakers and thermometers and all this stuff. So I measured, all right, 100 to 120 degrees Fahrenheit is 38 to 49 degrees Celsius, in case anyone is watching this from a country that uses Celsius. Boiling is 212 or 100. I have an instant hot water thing, so I measured that first. From those instant hot taps, mine came out at 178 degrees. That's pretty hot. So I did some research. When you get a cup of coffee or tea, it's usually served at about 160 degrees Fahrenheit or 71 Celsius. Except for the McDonald's drive-through. Remember that lawsuit? So I went, okay, this is still too hot. So I turned on my hot water tap and measured that. It was coming out at, that's backwards. It was coming out at 108 degrees Fahrenheit, 42 degrees Celsius. Would you write me a note to change that, Drew? Okay. Now that's where my hot water heater is set. So basically the hot water from the tap is right in a good zone. That's going to be what most people's hot water tank is set at. On the can, it says lukewarm. I will tell you when measuring it, I consider lukewarm to be colder than that. When I got some that I said, okay, that's lukewarm, and did the temperature, it was below 100. So here's what you would do if you were making some gel mix. 4 ounces. I'm doing everything at 4 ounces to nectar consistency so that it will be consistent. You've got this little bitty scoop. It's a tiny amount compared to all the other thickeners. And generally, and there are some exceptions that you can read about, but generally it's 1 scoop per 2 ounces. So we would need 2 scoops. Yep, and it was packed. Yes, packed was, well, yes. You see room for error here already? Here's my boots. Now this water, this is some room temperature water. Just so you know. I'm going to see because I don't know if it's going to come out differently. You be the shaker. We will talk about that too. This is water that we got out of the hot tap. It is now cooled. I don't have a thermometer because I forgot it. But I can tell you from comparing, this is probably right at about 110. Do you see why I want a viscometer? Yes. Okay. Yes, I do have a Sharpie. Yeah. Well, we'll just have to do that. I do have a Sharpie. Can you see any difference? Yeah. Okay, so let's give it 5. You keep yours. I'll give mine to Treva. Treva, you're hot. What?
Breast milk takes about 10 minutes after you put that mixture in there and you sit there and breast milk, you can't shake it, you gotta swirl it. So you sit there and swirl it for 20, 30 seconds. And then it takes
Really?
More likely to shake it.
Why do you swirl breast milk instead of shake? What breaks what down? Okay, okay.
Swirl gently.
So that we keep the breast milk consistent.
How many times is this going on in the household where the parent knows it is shaking? I don't have time for this. If my baby's preemie and they preemies that are even after they get discharged, they can't just sit there and cry. They have to conserve energy. I don't have time for this, Liz.
Wow, they're swirling and shaking. So that you know, gel mix says you must be at least 6 pounds to be able to get some gel mix. This came from their medical advisory committee. That was what they said at first. That website has been updated now to say not for use with infants under 42 weeks gestation or under 6 pounds. So I asked, I'm like, well, where'd you get that? What, is that based on a study? Why? And I was told gel mix consultants deemed 6 pounds as the minimum weight to ensure infants have met their term by date, to make sure they're full term now, to avoid the development of neck. So I wrote back and I said, well, who are your consultants? And hey, by the way, have you seen that these babies, some of them have gone home already when they developed neck? Do you know about this? What do you have? What are you saying? And I got back from Dr. Enrique Hernandez Sanchez, their pediatric gastroenterology consultant. He said, well, the main problem with Simply Thick is that it's the large amount of product needed to thicken to nectar consistency. And since you need so much less gel mix than Simply Thick, we think we're okay. Do you hear the we think we're okay? Mm-hmm. Who is this? Oh, okay. The warm one looks a little thicker to me, but I'm not walking this thing.
I think it's thicker.
Which one?
The hotter one.
Okay, that's what I was saying. I think it looks thicker.
See, we need one. Get that sheet out the
I want this covered! Okay. I wonder, would it have been different if we had not swirled if we had breast milk and we shook instead of swirled? We have a lot of potential for error and for difference already, don't we? And there is, and it'll tell you, remember the thing about as it cools, it thickens more? And what if you've got a screaming baby? Now, starts out at nectar, thickens to a thin honey within 20 minutes. Can be mixed ahead and refrigerated up to 24 hours, but re-swirl or shake before you give. So I asked again, now you're giving me specific instructions because it says the instructions are by weight, not for attaining different thicknesses. And if you read Simply Thick, we've got nectar and honey. If you read Thicket, we've got nectar, honey, and pudding instructions, and so forth like that. So I said, well, where are the instructions for the different consistencies? And they said, gel mix is a dietary supplement for thickening, not a treatment for reflux or dysphagia. While thickening feeds is often recommended for dysphagia, aspiration, GERD, spit up, etc., gel mix thickener is not intended to diagnose, treat, cure, or prevent any disease.
So what is their marketing strategy?
That it's close enough.
The big thing is, their big thing is we can thicken breast milk. But for whom are we wanting to thicken breast milk? Kids that might aspirate or have reflux. Do you see why I've got reservations about this? Now,
Melissa really didn't know what she was talking to.
pardon?
That Melissa really didn't know.
I'll also say that we try weaning them off the gel mix because it is such a small amount that you're trying to add. You start doing like half scoops and quarter scoops. And, like at what point, at what level are you doing so small amount? that you
have to, yes.
have to focus on the thickening.
It's a lot harder to do half of that. Now, that said, it sounds like I'm demonizing gel mix, and I don't mean to. Don't you have some patients you're like, but this is better than the alternative? Yes. But what I want you to get from this is that there's no easy answer, and there is no pat answer. And as you're going to see by the time we're done, there's no true consistency in altering consistencies. That's pretty good. So doing the math, just to look at how much you'd have to add, yes, to get to nectar, you're going to need 15 grams for 4 ounces to get to nectar with Simply Thick. Yeah, that's, compared to the others, that's a lot. If you're doing rice cereal at 2 teaspoons per ounce, because we don't necessarily have any guidelines established by a viscometer on does 1 teaspoon equal nectar or what are 2 teaspoons? We don't know. So I've got both in here. And gel mix, yeah, that's a lot less. But something no one else is talking about, could any of this affect adults? How many of you treat geriatric patients who have GI compromise? We don't know. And there's not going to be research on safety except retrospectively. Because how do you do the study? Now, Thicken Up Clear uses maltodextrin, xanthan gum, and potassium chloride. It's powdered. There are, for thickening 4 ounces, you need 1.4 grams for thickening 4 ounces to nectar consistency. They put on their stuff for 3 years and up. So basically don't do this with your really young ones. And their deal for thickening is totally different. Thicken Up Clear. I'm just going to open one of these because it's easier than measuring right now. You pour the powder in first, and then put your liquid in, because apparently that will make a difference. And then, where's my stuff? Do we stir, shake, swirl, or what? What's it say on there? Stir briskly? Then it means I need a fork. You can see some powder stuff in the bottom. So if you're doing water, that's great. You can see when you've got it done. If you're doing something opaque, you might not. What if you change somebody from one thickener to another? What if they go from one facility to another that uses a different thickener? Would that change things? I'm going to pass this one around. You can see, and I'll leave the fork in it, you can see the lumps and the clumps. Sorry. Thick and Clear, that's the cellulose gum one. They will not come out and make any age recommendations. They're not saying period. It's probably, I can understand why. You can mix it at room temperature. It doesn't thicken any further after 5 minutes. But remember, like with gel mix, we had to wait at least 5 minutes for it to get to the right thickening. Do you realize you've got to really read the instructions for each product that you use? But let's look at, okay, let's say you found the thickener that you're going to use with this person. Could it affect other things in their health? A good thing, we've always wondered, would putting them on thickener get them dehydrated? Yes, but not because it binds with the water. If it does, it's usually because people don't like to drink thickened coffee and stuff like that, and they just drink less overall. It does retard drug release. What if they're on long-acting medications? What about cardiac meds? What about anti-seizure meds? Could it play havoc with that? Yes. It increases satiety, or that feeling of fullness, and decreases flavor, which may decrease then intake. and it increases thirst. You ever noticed how you can be really thirsty and you're like, a Coke is not doing it? That milkshake is not doing it. I need water. I need to quench that thirst. Is this mine? Let's go here. What about interactions with the different kinds of thickeners? Which ones do they have with foods and liquids? Well, starch thickeners have more calories because they're carb. So if you're reducing the volume that the person is taking to compensate for those calories, if you're having to watch to make sure this person doesn't get too many calories, well, then they're going to have less liquid available to obtain the other nutrients and less fluid. With gum thickeners, the gel thickeners displace liquid ounce for ounce. So if you're adding 15 grams of the gel, then it displaces that much liquid. So if you may have to increase the amount of formula that they get to still get the same amount of nutrition. Will the kid take that? They have little to no calories but can take up volume doing what I just said. There are other things out there. Knox gelatin, egg whites. Some people are using, not therapists, but family members and so forth may use egg whites or yogurt, for instance, in soups to thicken. There's agar. What have I got up here? Oh, you can buy xanthan gum, just powdered xanthan gum at the health food store because you use it a lot in gluten-free baking. Oops. Agar powder. That is this one. It's from algae, yeah, but it's not green. So, vegan, gluten-free food. Some people would double the amount of powdered formula. That's going to mess nutrition up a little, isn't it? Okay, what about iron? Some people have added powdered milk. Again, just looking for ways to make it safer going down. But you've got to realize what else you might mess up. But you guys, have you seen how difficult it might be to thicken to the same thickness every time? Temperature makes a difference in the product, whatever product you're using. But honestly, the temperature of the liquid at the time of mixing, I could mix something cold and something warm with thicket, and it might thicken to a different consistency. And you know what? When you put stuff in your mouth, you warm it up. Do you have some patients who keep foods and liquids in their mouth for a while before swallowing? You're raising the temperature of that bolus. It's not going to be the same viscosity going down the pharynx that it was coming off that spoon. Time. Now, we have a little bit of conflicting between some of the studies that it may not actually be a conflict, but unfortunately, we don't have a good definition of terms in the studies. In one, they said that using starch-based thickener, so I don't know, is that cornstarch-based or rice starch-based? They found that formula would get thicker over time, but breast milk gets thinner. Well, we know why breast milk gets thinner, because of the amylase. Another study found that liquids, and I don't know, was that formula, what was it? That liquids thickened with rice cereal got thicker over 30 minutes. So I'm guessing that's formula. But corn-based got thinner over 1 to 4 hours. Look. Do you know that saliva contains amylase? So we've been thinking that whole amylase thing, only those therapists working with babies had to pay attention to that. Saliva contains amylase. Okay, somebody with a viscometer looked at, there's a 90% reduction in viscosity within 10 seconds exposure to saliva. You want to see some exposure? Tongue pumping, swishing it around in the mouth. Now guess what? Backwash. This is now going to thin out if it were thickened. Having anterior stomach. Cool. there is a 100% reduction in viscosity in 20 minutes. How long is a meal in a nursing home? Backwash. It was somewhat less when gum-based was added. So like with a hybrid, somewhat less, but we don't have any numbers for that. Different liquids and formulas require different amounts of thickener to come to the same consistency. I had this great chart that Cooks had put out a couple of years ago saying, okay, with this formula, you need this many teaspoons, and with this formula, you need that, or I'm sorry, I take it back. They had, in order to get nectar consistency, you would need this much of thicket, or this much of rice cereal, or this much of Simply Thick, so on and so forth. And I was like, hey, can I use this? This is great. Rice cereal, oatmeal, and so forth. So I called, and she said, throw it away. And I went, why? Because different formula. Enfamil versus Similac versus Good Start require differing amounts of the thickener to come to the same degree of thickness. Uh-oh. What does that mean for the drinks on the tray in rehab, in the skilled nursing units? Apple juice versus orange juice, we've got different acidity levels, versus milk, versus coffee, versus hot tea.
Different brands, if you use a different brand of rice. Like that beach nut is a lot more fine than like the Gerber, so you have to put it.
Yes, and I'd actually meant to bring that out. Look at the difference between the beech nut and the Gerber. One reason that when we are doing rice cereal, I prefer beech nut, aside from the whole thing with arsenic. Okay, the first one to go around will be the beech nut. The second will be the Gerber. Look at the difference in the flakes.
Okay, and I have a question. I have long-term living facilities. A lot of my patients don't like to drink room temperature water. So I have seen nurses and staff have like a bucket of ice, you know, one of those pink buckets, I don't know what they're called, and they put the actual thickener of water and put ice in the bottom and stick it in there to make it cooler. That's going to change the consistency, but it increases hydration.
But it's better than adding ice.
It's better than adding ice to the actual thickened drink. As you're going to see, it's a crapshoot what kind of viscosity they're going to have when they swallow anyway. Yes, it is. There's no way you can replicate. There really isn't. So you look at, in general, do we think this is a good idea? And in general, is it working for this person? Apparent viscosity is also very dependent on how fast the swallow is. When you swallow faster, it can seem thinner or thicker than when you swallow more slowly. When we do the modified barium swallow study, how many people are going, oh, yay, give me more? When you have to swallow something you don't like, do you swallow faster or slower? It depends. You might be someone who's saying, let's get it over with, or you might be trying to inhibit a gag. Thickened barium does not necessarily replicate thickened formula or thickened foods. Do you remember seeing that wide range of what is considered nectar and what is considered honey? Pre-thickened liquids, the ones that you buy, you're like, okay, that is something that will be standardized. Yeah, but they consistently test thicker than those that a therapist looked at and said, okay, this is nectar, and thickened it with an added thickener to nectar. So if they're using pre-thickened stuff in the swallow study and saying, okay, we need nectar consistency, but at bedside somebody's adding in something, it's more likely going to be thinner than what was used in the swallow study. And we got to talk about something else. We mentioned that you never eliminate aspiration, you reduce the risk. So which is worse? To aspirate more of something thinner or less of something thicker? So I asked me, in general, thicker substances are harder to clear from the lungs. Do you know the AR formulas, the added rice, the ones that thicken in the stomach? They're actually potentially worse if they thicken more in the airway. Watch out. Breast milk, oh, and by the way, they're thin, they're like a thin tube coming out of the bottle. And they thicken more in the stomach on exposure to acid and at body temperature. But they could continue to thicken more in the lungs at temperature. So this is coming from a doctor. He said, I'm not as concerned about breast milk in the lungs as I am anything else. And also something I had never thought about. If this is somebody who's already sick and say has viral inflammation, there will be a breakdown of the mucosal barriers in the lungs. So if a non-human protein or a polysaccharide, think a gel, is aspirated, that could actually lead to allergic sensitization. But we kept you from, or we made you aspirate less. There's actually a higher incidence of pneumonia, dehydration, and UTIs in a group. They did a study comparing those that used thickened liquids versus those that stayed on thin and did a chin tuck. We had higher incidence of pneumonia in the thickened group. But I thought we were doing the thickening to prevent pneumonia. May reduce the bioavailability of calcium, iron, and zinc. How do you do research on it? It's pretty hard. This whole thing about human subjects. And we've got people making homemade thickener. Also, there's a video on YouTube on how to make your own Simply Thick. Oh. By therapists? Jennifer is saying that there was something going around on Facebook where someone was posting their recipe for homemade Simply Thick, giving it to therapists to use. I would not. There's no way I would do that. That so increases your liability. And honestly, after doing all this research, I'm not a big fan of thickening anymore. I'm really not. So then what can we do? You're like, okay, Jen, hello. What answer? Honestly, I'm going to go with positioning. That's one of the first things I'm going to do is positioning and finding another way to slow the flow. So in our babies, if y'all on the web, you can look there, elevated sideline. And there are studies getting published that show elevated sideline helps quite a bit. And those should be in your bibliography. Chin tuck, for older ones who can do a chin tuck. Now remember, it's not this. Okay, chin tuck. You remember the dance to walk like an Egyptian? Not that I ever danced back then, I was Baptist. Okay? Still can't dance. It's got bred out of us, over so many generations. So it's like this. Okay, that's a chin tuck.
I did not know that. I didn't know that either. I still don't know that.
Stick your head forward. Now pull it back. That's a chin tuck. Oh, wow. That's a chin. This is not chin tuck. This is yes. This is saying grace or contemplating your pretty new shoes.
I never knew that.
I need to call my professor.
I remember that.
Let her know that she was wrong.
I'm sure she'll appreciate that.
I always learned in grad school. How many speech pathologists know? I've never heard of that.
I do know.
I can see why, because I can barely swallow.
Okay, she asked if you would go back over what you just covered.
Okay, I'll go back over what I just covered for the folks who missed it. Let me set this here because I gotta remember to read that to y'all. Let's grab a nipple. So I'm gonna do that in a minute. Okay. Putting an infant, I'll just do the whole slide, okay? Putting an infant in elevated side lying and look at the pictures, okay? think about what that does anatomically. If you've got a baby, my baby doll, all right? If you've got a baby in your arms like this, okay, so here's the baby. If they lose control of the liquid, where's it gonna go? Over and down because of gravity. Now, if that kid's like this, and he loses control of the bolus, where's it gonna go?
Pockets in the cheek.
Hopefully pocket here, maybe you can come back out the interior. Also, when the baby is in elevated sideline, they can better control flow from the nipple. When they're like this, you've got gravity pulling stuff down too. Okay? So, yes.
Do you have any recommendations for, let's say you have a kiddo that does well in that position and not the other positions? Let's say you want to take them in for a swallow study. How do you ask them to position for that?
I say you should check it in sideline, in elevated sideline. You can check it under fluoro.
But don't they have a hard time setting up all the...
Here's what you do, it's actually easier. You take the tumble form off, take the foot plate off, you have the C-arm, you have the table and the thing, tilt it like this. And then put that baby on their side, laying on the table. And you come from the top, coming like this, hold the head, hold the bottom. Is that how, I mean, that's how we've been doing it?
That's how we do it.
Then there's pacing, okay? With our, well, I won't go to adults yet. With our babies, sometimes what this means is they're drinking and every 3 to 5 sucks, depending on the kiddo, you simply tip it down. You don't yank it out. If you yank it out, they're going to suck a lot of air. It's going to be very disorganizing and could actually increase aspiration. You just tip it down. They'll do 1 or 2 more sucks and then kind of go, oh yeah, nothing's coming here. And they'll take a little break. And then start it again. It reminds them to stop and to breathe, which sometimes what's going on with some of our kiddos is they're not stopping to breathe and then they're aspirating and all this stuff is coming over and down so fast. So let's have less going over and down and give them a chance to regroup. Okay? Slowing the flow by what nipple you choose. Okay? There is included in the handout, with permission, this chart, nipple flow rates, commercial and disposable. This was done, actually the PT, Kelly Jackman did this. It has now been published. So I cited in your bibliography the published article, which actually just came out in last month. But she used a breast pump. So she didn't do it like we did when we had nipple night here and we just tested ourselves and used wine. She actually used a breast pump, so it was more standardized, which makes more sense. And she talked about the flow rates, and I want you to see, I've always loved the Gerber slow flow. It's one of the highest rates. I had no idea it was that fast of a nipple. Okay? So that's something to look at. If we can make it so that the nipple itself restricts the flow rather than adding something in to do that. And that's really the way I prefer to go. What about our adults or our older kids who are not on bottle nipples anymore? Okay? And what I'm going to do right now is let Treva talk about this part, because this is really her area of specialty. And then I'm going to come back and wrap up a couple of things. And while she's doing that, I'm going to, Treva, will it bother you if I pull in some of these and put it in the bottle? Because I think we're going to do this.
Jennifer, my gel mix has gotten considerably thicker.
Oh, really?
Yeah.
Robin said that her gel mix has gotten considerably thicker. So it's continuing to thicken. Is that the warm one or the room or the regular?
This is mine.
So this was the room temperature.
That's the long one. Maybe I got more concentrated, who knows?
But would that not happen with our families?
With the thicket.
in that. So, I mean, I'm just looking at some of my peers. It doesn't look as thick as mine. But yours is not as thick as mine.
And we all use, with the gel mix, we all use that same scoop to measure. Are you scared to recommend thickening now? Okay. And do you see why the most important part of the modified is not coming up with nectar, nectar and a half, honey minus a fourth, or whatever? It is, what are the structures, what's going on, what's the physiology, and then you know what?
It's a lot of
Positioning.
Position, and look at possibly some other things here. And yeah, you can go ahead and recommend thickening, but remember what it could do to the nutrition, to the hydration, to aspiration consequences, so forth like that. Honestly, thickening is my very last resort these days. And I want it on a recording. Something happens to me, I don't want any thickening. Okay, so y'all, if I end up in a coma or a head injury or something, I want no thickening. Okay. All right.
Even in a margarita, I'm sure.
I'll just drink it straight and die happy. Is that even in a margarita? These are yours?
That was the one.
Okay. Big old white. You know what? We've got 5. Actually, we're supposed to be done for the webcast people. So you show your stuff. No, you show your stuff. I won't do what I was going to do with the nipples. I almost said I'll move to G-shape.
Okay, with the different cups, you've really got to be careful because some of the spouts are very flexible. And so, like this one has like a slit in the middle of it. This is a born-free cup.
Does she need the microphone?
Oh, yes. Thank you.
Testing. Houston, we have a problem. All right, we're talking about the born-free cup. And what I was saying was this spout is very flexible.
Sorry.
It keeps getting, yeah, well, we're good friends. Yes. Anyway, even though, just hold it. Hi, I'm very professional. Yes, this has a slit. And as you can see, it's very flexible, so you can imagine a thicker liquid will probably not come out as well, or the spout will collapse, so you're not going to get any liquid anyway. So, we can like that one. Oh, very good. This is a Dr. Brown cup. Now, it's a little bit more flexible. No, it's less flexible. It's a little bit sturdier, and it only has like a hole, just one little hole in here. So, but we did find in the previous night that this one did work pretty well for the thicker liquids, surprisingly.
Couldn't figure out why.
Right, that did. And this is the Boone cup, and you can see this is very sturdy, and it has a slit that goes all the way across.
Never seen that.
And
It looks like it should come from IKEA.
it looks like it does kind of slope upwards. Yes. So let's see. We've also got tried and true. Playtex Coolster, that's right. This one worked really nicely. It does not promote as much tongue thrusting because you've got a nice bridge here for the lips to collect around. And since you have a wider base, then you've got a nicer flow of the consistency.
On that one, what about the valve inside? Do you leave it on with it?
No, I don't leave it on for thickening with the thickened liquids because it's just, you don't get any out.
Treva,
Yes.
can you speak up a bit?
Oh, yes, I can speak up a little bit. We were talking about the Playtex Coolster, and Chris brought up the idea of taking out the valve. Okay, let's just do that. Because with thicker consistency, it's not going to flow as easily. But the good thing about this cup is it has a great place for the upper and lower lip to mold around. And so you're going to have hopefully a little bit better control of that liquid coming out of this cup.
If she was talking too soft earlier, this one actually worked nicely for thickened liquids, and it's a Dr. Brown's. And these two did not.
This one's born-free, and it's a very soft spout. We don't like the shape of that spout anyway, but it collapses fairly easily if you're trying to suck thickened liquids through it. And this weird-looking one with the boon, never remember that name. You want to tell them what you said about the boon?
The boon has a sturdy, kind of a sloping lip mount. And so with the slit, you got fluid coming out, but we did find that there was a difference in flow as far as if the
That's right,
if it was up or if it was down, depending on the slope.
Or this one. We'll change the flow.
And this is, I believe, this is a Playtex cup also. This is the twist and click. This is a more recent design. It also has a valve. This will work pretty nicely too for the thickened liquids. You've got the same, similar setup, maybe not as large of an opening as the Coolster, but this is also a good one for thickened liquids. Now, if
What's the
you're-
name of it?
This one is called a twist and click. It's Playtex. Puts this one out. And of course, just a regular kid's cup or a medicine cup is a great place to start because it's a smaller amount that you can case. Yes, and go ahead and talk about the. Now, for older, for our adolescents, adults, the Provale.
Look up how to pronounce it.
There you go, Provale. Anyway, it has a nice little flow system that will bring the liquid up, so it kind of incorporates the pacing technique already in the cup. So, and of course, they also have weighted cups, so you can bring any of those, but there's a nice variety.
But this last one works with thickened too? It still has that
Yes,
nuance?
it does.
It is expensive though.
Yes.
What was it, $60?
Wow.
Which is why I called Treva and said, if you got one of those, can you just bring it? And I wanted it, Rhonda Polanski, so did you? So that's what we got for cups. Oh, and the Top Tools purple cup has two different lids. Wait, oh. Is that what you were waving at me, Jim? Was this what it was?
No, someone is asking if a child is appropriate for straw or honey bear to start. Does you think better for thickened liquids? I don't understand that question.
If they're going to straw, should we start with thickened liquids? Was that the question? If that wasn't your question,
Or using,
type back to
I
Jim
think
again.
using
What
maybe
is it,
thickened
sunlight
liquids
versus
on the
honey
honey bear cup from Top Tools
Well,
for
it
time
kind of
retraction.
depends on the individual, because if they're sucking up too much, it's going to cause problems. You're going to have a larger bolus that will go everywhere. And yes, if it's thicker, it will be slower, but you're going to have less control. I personally like a cup because I can pace it. I can control how much is actually given. And in fact, I may not even start with a cup. I may start with a feeding dropper that Marjorie Meyer Palmer puts out. It's a very flexible feeding tube. I may even have one in my purse.
Got one upstairs.
But
Sorry, go ahead.
it works similar to a syringe. Of course, don't be syringing, please don't. No, this is a feeding dropper that looks like an eyedropper. And you can aspirate some of the liquid into it. And then as the child bites down, they can emit some of that liquid into their mouth. So you're getting a smaller amount just as a beginning, maybe a taste, or just small amounts to get started with. Let me see if I can find one.
Okay, one question first. What would you say about if you are teaching thickened liquids, if you are teaching straw drinking, do you want to teach it first on thin or first on thickened?
Once again, it depends on the
Depends on
individual.
the kiddo.
Because-
When would one be appropriate over another?
Well, I'm going to ask about the swallow study and where is the cooling taking place? Is there any? Where is aspiration? Before I make a decision. Yeah, I'm not going to make a decision until I know that, until you see.
Okay. All right, she's gonna look for that, and what's it called?
Feeding dropper?
Feeding dropper, thank you. No Moss feeding dropper. While she's looking for that, the Top Tools purple cup. Are you just stretching?
No, they're asking because of hyperextension of the neck with a sippy cup.
Because of going like
I
this?
think they're saying straw versus.
Straw versus sippy cup?
Yeah.
I
Okay.
think so.
and actually, honestly, that's a reason to teach open cup first so that they're not doing this. Would you teach straw in place of sippy to avoid neck hyperextension?
Depends on the
It
kid.
depends. Yeah, I'm sorry.
Yeah.
That's the best way to, that's the safest way to do it, is to, what kind of position are they in? Can you modify the position? Can you give them some jaw support so that they're not doing this? You may have to do some head support. It just depends.
Well, and that's why the Playtexes were one of our favorites, just because they most simulated
Yes.
open cut.
That's true. That is why that came the closest to open cup with, and I just blanked, so that they weren't doing this. Hold on. And that's what this does as well, the Top Tools Purple Cup. You put the lid in and they're doing this restricted flow. It gives the right position but still restricts the flow. So that's what we liked. And the Top Tools Purple Cup has a lid for thin and a lid for thickened. Okay. Yes, and this is the feeding dropper that I was telling you about. It's kind of like the aquarium tubing, but you can see it has sort of a bulb on the end of it where you can actually bring the liquid up, and then when they're biting, it's real easy, it's real flexible to manipulate in your mouth, and it's a nice way to get started. Do you want a close-up of that? And they come in one per package. You have to order them out of California. I think they're like $30 a piece. Don't you get any closer? You see that?
Let me tell you about this, okay? Let me pull here. This was in the New York Times in 2013. It goes through a story about one of the babies who died due to neck after ingesting Simply Thick. And this is a tear-jerking story. I mean, this is hard to read. And it goes on and talks about the things that were done, and you hear about little Jack and so forth. And it goes into the story, but what you need to hear is the end. Dr. Yang, a neonatologist at Wake Forest University, is a co-author of a case series in the Journal of Perinatalology about 3 premature infants who took Simply Thick, developed neck, and retreated. The paper speculates that neck was most likely caused by stimulation of the immature gut by xanthan gum. Dr. Yang said she only belatedly realized there's a lack of data on xanthan gum's use in preemies. The lesson I learned is not to be totally dependent on a speech pathologist. It's the therapist that brought it into the NICU. Can we practice by ourselves? Can we treat dysphagia by ourselves? No. We can come in and say, here's this thing I'm using in the adult population. What do you think? Now, that's real nice that she's passing it off on us. She is still the one, the neonatologist is still the one responsible. How many of you know neonatologists who have a lot of time to sit around and do a whole bunch of research, looking into things? Are they really any different than us? No. So the takeaway that I want you to get from this is that we're offering these things and we're getting arrogant and we're getting our noses out of joint about it. It has to be this, it has to be this way, this is what has to be, or else. There's nothing consistent up there, no pun intended. And just, that was good. And that was online too. But what's going to happen in the home? How long is it going to sit? Okay? How much are they going to swirl, shake, or stir? How far ahead of time? Are they going to do a packed scoop or a loose scoop? Are they going to take the measuring spoons? Is it going to be loose? You know something I did? I was like, okay, it needs 4 teaspoons. Well, you know what? There's 3 in a tablespoon, and I'm in a hurry. So I did a scoop there and a scoop there. and went. Are they going to wait long enough after mixing? Or are they going to give it quickly enough after mixing, depending on the thickener used? And then you're not going to eliminate the aspiration. So what aspiration does happen? Is that patient going to be able to clear it from the lungs? What's going to happen there? If they're going to be on this long term, and you're adult, how are they going to like that cup of coffee that's like as thick as sludge? What's it going to do to fluid intake? How's it going to affect the medication? You can't practice in isolation, and you can't ever say, I've got the answer. First, do no harm. And remember, don't harm your patient was one of the ethical principles. Please be careful about thickening and saying, oh, we have to thicken or else he'll aspirate, and I have to cover my liability by saying it has to be thickened. I'm waiting to see a lawsuit that comes from thickening instead of just letting it be. I predict there's going to be one. If nothing else, don't be arrogant.